Well, with that, let me thank both of you again for an excellent discussion of and raising, frankly, a lot of clear food for thought. The fact that we have some observations or facts, but I think fewer answers and more work to do, both as researchers and also ultimately on the policy side. And with that, let me give you a few closing remarks, and I won't take too much time, since depending on your time zone, it's Friday night for some people and lunchtime for others. But I did want to try to wrap up, and let me begin by thanking very much Robert Field for his generous support of this conference and his effort at healthsystemfacts.org to try to basically have a fact-driven discussion of international health systems that's consistent with the effort of this conference to cut through the narrative, which certainly is often the case in the policy discussion or the popular press, but even within economics to some extent there, I think we have been a little bit too quick to say, well, that country's different, or, everyone says they spend less and live longer, but what do we know about their health system? And one goal of this, or a major goal of this conference, is to motivate a discussion about particular micro foundations, particular policy experiments, particular evidence across countries that can be informative at a more rigorous level, I would argue, than these kind of macro observations to us as health policy researchers and health economists, and also ultimately to changing some of the discussion about what we can and can't learn from other systems, rather than just dismissing them out of hand as either completely socialized medicine or not. And so I hope we can go that way. It's sort of in the theme. One effort here is in to paraphrase the sort of Keynes comment that how lots and lots of things are beholden to defunct economists in dark rooms. And we're trying to become those where we have a lot more to say that can filter into the broader US narrative as we may be changing and trying to improve our health system. So let me, on that theme, a couple of next steps and goals, and then I'll go through some kind of big theme takeaways that I saw. But we will be reaching out to all participants and then more. One goal is not just to have this conversation, which I will personally say has been incredibly productive and fruitful. And as someone who attends a lot of these, I used to attend them in person. It's now a lot more on Zoom. Often you see lots of technical papers that are much like your own, ostensibly cutting edge research, and you learn a little bit and you advertise your work. But this has been incredibly informative about core questions, evidence, big picture facts that we need to know to answer the big kinds of questions that are coming down the pike about how we deal with new, incredibly rare and expensive drugs and diseases, or how do we structure an ACA if it is thrown out by the Supreme Court, but in fact we get democratic leadership, right? So these questions, from the managed competition all the way down to cost control in the NHS or Taiwan, or data infrastructure in Taiwan, are actually very relevant to the conversation that we would have. So I personally, and I hope others have found it interesting along those lines. We're going to try to structure another conference with this group and extending beyond that for some time in the spring, where we can motivate the time and effort, which has been fantastic thus far, to introducing the issues, to thinking about actually how they map to particular policy questions that are coming up in the US. And we think those will potentially rise through very different directions depending on what happens next week. But nevertheless, there will be key policy questions. So let me just play back a few themes that I had in taking away from this. I think universal themes that I saw were starting yesterday and then really being emphasized heavily by John Gruber's keynote was managing and paying for innovation. That's central to all of this. And so I think Matt and Amitabh have frankly raised some really important questions and I think opened more avenues for research and policy than they've closed in a good way. And I think there's a lot to be done there. The other theme that frankly keeps coming up, and I think I'll blame myself here. I tend to be dismissive of this in some sense. I know the US healthcare system doesn't work that well, but tend to, again, respond to things like Japan spends less and lives a really long time with, well, that's not the health system. But I think as you dive in and you get the details of different countries, the real deficiencies across lots and lots of domains of our healthcare system become very salient. at the micro level. And I think there's two things that takeaways here, that we can actually address them, that there are models for these pieces that are not just trying to find small state experiments or regression discontinuities in the US, but instead going to much larger scale evidence in other comparable countries with very good data. I think the flip of that is too, before we vilify the US too much, is that actually we have learned quite a bit here, and that there are takeaways that can go the other direction, even going back to Carol's fantastic discussion of internal markets and how do markets work without prices. I think increasingly we have that in the US. We can also compare function with prices and sort of understand. So I think it should be a give and take, and I hope this group and the extended effort of this conference is to move that in that direction. The other big theme, which I think is very clear, is that political economy is so critical. Even we tend to take the NHS or the German system as given. The German system is very old, but it was a political moment that allowed it. And even, if you look at the actual political economy of the Beveridge report and the implementation of the NHS, it was not this treasured component of being British at that time. It was highly controversial. And so it is striking while the iron's hot and then working around it, which I think underscores the role for technocratic economists like us in terms of building up policies, because you don't have political moments over and over again, and you have to work with what you've got rather than waiting around for kind of big bang things. And the ACA would be a case in point in the US. Obviously, there could be some big changes, but we'll see. Let me think some other things that I just want to highlight. If I just looked at things that I took away as US opportunities that were thematic across the presentations, the role of IT and data was fascinating, and the fact that countries that have systematic data infrastructure, it's such an opportunity. Looking at Taiwan's ability to do this at quite large scale, I think it's clearly smaller, but 24 million people is a very large place, a very large country, and clearly using that to effectively pay doctors and reduce administrative overhead, and at the same time be more interventionist with that data about managing conditions. I think it's a great example to think about. The Nordics and the great work that we heard on extending these data and the role of health beyond the confines of physical health itself, and thinking about the interactions with the broader social safety net and social infrastructure. The fact that investments in may be much more effective than educational interventions later, right? Trying to get people not to drop out of high school is a very expensive way to try to improve outcomes, whereas investments in early childhood health are incredibly productive. And we saw, in fact, that the ability to do this and measure these results is largely a function of the comprehensive data infrastructure. And that's something we should clearly be thinking about. And relating that to innovation, I think coming full circle, both Matt and Amit made some Bluetooth issues, made great points about the need for these kinds of data infrastructure to do post-market surveillance. If we start thinking that fewer people are going to be treated with more innovative medicines, and the ability to do trials at best will be costly, at worst will be infeasible, or whether or not it's worse is an open question, but you're just going to have better data on health outcomes across domains. Even without the sort of utopian vision of managing chronic disease, which I think is a tremendous application, even if we just say, how are we going to actually regulate new innovations and new drugs? So I think it will fit into a lot of domains. And the last kind of overarching theme that I think is ripe for research, and this is mildly self-serving, but I'll go ahead, is that the role for behavioral economics in these kinds of managed competition environments was very clear across these settings, that if you're going to offer choice and competition, you need to understand how the market's functioning in these kinds of complex markets. And I think we're starting to see, I think a great example was the first off, one of the highlights I will say is that the using a platypus to describe the Australian healthcare system seemed like an apt metaphor, but the fact that they don't seem, actually, they're trying to measure innovation. There isn't evidence for a lot of innovation from competition amongst insurance plans, I think is a great point. And asking these kinds of questions in other contexts where we're frankly bending over backwards from a regulatory perspective to offer choice, it underscores the need to ask these kinds of questions. So with that in mind, and there are so many more incredibly interesting and productive points being made, and I hope everyone found it informative. I want to thank you all again for joining us for a marathon Zoom session. I know everyone has a bit of Zoom fatigue. I hope we've made it interesting and informative. We look forward to following up for next steps of this effort to increase research and policy dissemination along these lines. Obviously, if you have comments or thoughts about research ideas about the conference or want to be in touch with anyone, feel free to reach out, but both Ben and I are excited to facilitate that conversation, so feel free to reach out to us. So thank you very much and enjoy the rest of your afternoon, evening, Saturday if you're in Australia. We appreciate it. Ben, do you have anything else?
Nope, that's it. Thank you, everyone, especially to the speakers, but also to the contributors and to the participants as well. One additional thing to mention, especially for those of you, who have had Zoom fatigue or who have been able to come in and out, we do have videos for the sessions, and we are planning to organize those videos and the content from the conference into a concise website, which we should have ready early next week. And so we'll distribute that to everyone, just so you have, you can also use these talks and this agenda as a resource for yourself. So that's something I wanted to make sure I mentioned.
That's good. It will be on the new Gilbert Center website, which is also worth checking out. All right. Thanks, everyone. Have a great remainder of your day. Bye.
Thank you so much, everyone.